Does CPAP help with nighttime asthma? Have you ever wondered if continuous positive airway pressure therapy can help with nighttime asthma? Let's break this down and see how these two conditions interact. Continuous positive airway pressure therapy is mainly used for treating obstructive sleep apnea. However, it can also have some positive effects on asthma symptoms that occur at night, especially for those who have both conditions. When you use a continuous positive airway pressure machine, it delivers a steady stream of air through a mask. This helps keep your upper airway open while you sleep, preventing it from collapsing. This is important because asthma and obstructive sleep apnea often share similar symptoms, like nighttime coughing and wheezing. While continuous positive airway pressure therapy is not a direct treatment for asthma, it can help improve asthma control by addressing issues that make asthma worse during sleep. One way it helps is by reducing airway inflammation and sensitivity. By preventing airway blockage, continuous positive airway pressure decreases irritation and inflammation in the airways. This can lower bronchial hyperresponsiveness, which is when the airways become overly sensitive and constrict easily. Another benefit is that continuous positive airway pressure can improve airflow and increase the size of the bronchial tubes. This means less resistance when breathing, making it easier to get air while you sleep. Interestingly, this effect can last for up to 24 hours after using the machine. Regular use of continuous positive airway pressure has been shown to decrease nighttime coughing and wheezing. Many studies indicate that patients experience fewer asthma symptoms at night due to improved airway stability and reduced acid reflux. Speaking of reflux, continuous positive airway pressure can also lower the risk of nighttime acid reflux, which can trigger or worsen asthma symptoms. Long-term use of continuous positive airway pressure in patients with both asthma and obstructive sleep apnea has been linked to fewer asthma attacks and better overall asthma control. However, it is important to note that continuous positive airway pressure is not a standalone treatment for asthma. It is generally recommended for those diagnosed with sleep apnea alongside asthma. Asthma management usually involves medications like inhalers and corticosteroids, along with lifestyle changes. Continuous positive airway pressure can complement asthma treatment by improving sleep quality and reducing factors that make asthma worse at night. This can make asthma medications more effective. In summary, continuous positive airway pressure therapy can help with nighttime asthma, especially when asthma coexists with obstructive sleep apnea. It improves airway function, reduces inflammation, and decreases asthma symptoms during sleep. If you have asthma but do not have sleep apnea, continuous positive airway pressure is not typically recommended as a treatment option.